who cannot attend today's session. And welcome everyone. And good morning and good afternoon, good evening, depends on where you are. And this is for the open house session for Master of Science in Healthcare Analytics and Intelligence with the Rutgers Business School. And so my name is David Ding. I'm an assistant professor as well as a program director. Okay, I got a chat box. All right, and so with me, I have the pleasure to introduce Tiffany McKeever, and who is also a proud alumni from the program. She's currently the founder and CEO of Consensus Healthcare Consultants, and also Professor Joe Agresta, who is currently our assistant professor in professional practice with Rutgers Business School. And we're going to have time for each of us to introduce ourselves a little bit. And the basic agenda for today is we're going to talk about why we should have a special master program specifically in this major. And also we're going to discuss about how this program is unique and different from others. And the last one, definitely, we're going to have more time to discuss if you're interested in pursuing this direction, what is going to be the next step and how we can help you. All right. So we're going to start with introduce ourselves. Okay, Joe, would you like to start?
Sure. Hello, everybody. Well, welcome. And it's great to be here. So I'm Joe Agresta, and I joined Rutgers Business School about 2 years ago after a 40-year career in industry, last 20 years at Johnson & Johnson. And it's fantastic to be part of this program with David and Tiffany. I have the responsibility of working with an advisory board, which Tiffany is a part of, for this program. And really what my role is to bring the hospital delivery network and industry together to make sure that we've got the very best thought leadership on the program. And at the same time, create an experiential learning situation for all of you. So I hope that when you join, we could work together and partner you up with some great companies. So thank you, and glad to be here.
Good afternoon, everyone. I am Tiffany McKeever. It's so nice to see everyone today, and happy you guys could join us on this Saturday. We're very much excited to have you. As David and Joe both mentioned, I am alumni from the program. I started the program in 2018, and I finished the previous May in 2019. So, I'd be able to answer any questions you have from a student perspective. But as David also mentioned, I am the CEO of Consensus Healthcare Consultants. So I also wear entrepreneur hat. So I would be the entrepreneur coming out of the program to talk to you about industry. My past experience is in pharmaceuticals before I started Consensus Healthcare Consultants. And I wore many hats in those roles as well. So I hope through the presentation, I'll be able to talk to you about some of that experience and the conversion and how the degree has helped me.
Thank you both. So again, my name is David Ding, and I'm currently the program director. And this is a fantastic program that you are interested in. And I joined Rutgers a little bit before Joe, and this is my start of my third year. And my background was in the research and industry consulting within the healthcare analytics and healthcare efficiency cost management aspects. And prior to Rutgers, I was at Penn State and University of Houston for altogether around 10 years. And, I look forward to have the further conversation with you all, regarding this program. Okay, without any further ado, let's get started. So we're going to look at the first one, why this program, all right? And I'm going to go quick on this one. This is a very basic background information regarding, what has been going on in the industry over the last decades, where we know that our whole society is turning into an aging society with over 20% in the retirement age within the next 10 years. And at the same time, we're spending quite a lot of money, which is $5.5 trillion, 20% of GDP in healthcare. And at the same time, from a cost standpoint of view, the actual operating margin for nonprofit hospitals in the nation is only 1.8%. Okay, and so this is a look at, when we compared with operating margin for a lot of commercial industries such as Dell Computers, such as J&J, which oftentimes in 2 digits. And the margin for hospitals are very, very thin, which means that they have to control the cost very well in order to continue the business. Of course, at the same time, this becomes one of the very tricky questions when I got a lot of questions from the applicants where, for instance, some of the applicants, did not have much experience of healthcare in the United States, but they're interested in applying what they learned in our program to other contexts. And I think some of the common challenges we're facing, not just in the United States, but also worldwide, is address a cost concern, improve patient outcome. Over here, which is very common, as you can see, that average patient satisfaction is only 3.4 out of 5. If you think about the general experience you have with other commercial industries, and this is something that we can improve in the future for sure. And lastly, and we have, depends on what numbers you're looking at, we have roughly around 440,000 patients, which are equivalent to 500,000 patients died in hospital each year because of preventable human errors. So I think even though we are looking at specific contexts in the United States, but I think a lot of issues, problems that we're looking at over here applies to all different contexts. So, but I guess it's fortunate and also unfortunate. And the United States has one of the most complicated healthcare systems, which provide a lot of opportunities for us to learn, to grow, to better enhance our performance down the road. All right, so some of the trends and opportunities along the slides I just mentioned, so first one is the big data and healthcare analytics. When we're looking at the whole industry, it's transitioning from the value-based care, if you're not familiar with this term, which essentially starting from 2012, the whole industry in the United States in healthcare is transitioned from the value-based care where, physicians get reimbursed based on the number of patients they see, they prescribe, over to value-based care where they have to demonstrate not just volume, but also how much cost they have been able to operating, and what is the patient outcome, patient safety, as well as patient experience, and the financial and also the clinical outcomes. So within such a transition from volume to value-based care, that tons of different opportunities opened up for us to look at how care providers, physicians, and also suppliers in this network should perform. And the second one is a multidimensional metrics. Along the value-based care, there's another term you might heard, which is triple aims, looking at enhanced better access to care, better quality, and lower cost, which also opens us a lot of rooms for us to look at how to address health inequity and how to better address patient outcomes through data analytics. And the third one is collaboration across multiple different stakeholders, which essentially, if you're looking at what we are looking at in the healthcare industries, we are looking at a patient-centered care, which is oftentimes team-based. And this team-based involve not just the PCP, principal, your family physician, but also looking at a specialist and the technician and the nurse and social workers and so on and so forth. So we have to have a team approach to collaborate across the team in order to deliver care. And last two, we have advanced process management, which oftentimes we're looking at the lean application or Six Sigma application in healthcare. There are also a lot of potential areas for us looking at step by step, how we can improve process over time. Last one, which essentially is something we have been exposed during the pandemic, which essentially is how we address the issue dealing with the supply chain, dealing with the shortage of PPE, dealing with the shortage of all medical supplies, including how we can supply enough vaccines once Pfizer and Moderna was able to really reach the 95% efficiency or efficacy of the vaccine. How can we design such a supply chain so that the general population might be able to get access to those vaccines? All right. So so what is it and why it's important? So this is the diagram I want to show you, which essentially is kind of highlight about the direction we're moving to for the program. So you heard a lot of data scientists, right? And those are the professions who are very good at data acquisition, data manipulation, programming, advanced statistics. And oftentimes they're working in the backgrounds, manipulating the data, applying different models to come up with some results. And at the same time, we know that stakeholders such as ourselves, such as executives and managers and nurse practitioners, physicians in the hospitals, oftentimes they are struggling with some of the issues, some problems you need to address. And so what we saw from the industry, generally speaking, is those are the two groups run in silo. And data scientists oftentimes the only knows how to manipulate the data and how to apply different mining and program skill sets to handle the data. And the stakeholders oftentimes do not really have a good understanding for the data itself, but they know what is a problem, right? They know what it needs to get to. And for instance, addressing the shortage of supplies, or dealing with the patient experience, or dealing with the environmental service management. And they are not necessarily talk with each other. And this is a huge gap between those two because they're using different languages, they're using different jargons. So that's why we see that there's a need for the profession, which is also the profession, not only for healthcare, but also for a lot of other business industries where there's a specific needs for healthcare and analysts who understand the database, know the jargon, be able to apply analytics and the different package to address those issues, solve the problems, visualize the results, have a good understanding for intermediate statistics, be able to apply. At the same time, what makes this profession challenge is the sense that they need to share the intellectual curiosity with the data scientist so that they can work in a team. At the same time, they need to understand the data structure, be able to apply statistics, know the jargon, understand how to apply programming. Depends on the type of the interest those profession has. They can either shift more toward data scientist or they can more shift towards the application of analytics. And so another challenge for this profession is really understand the industry, right? They need to have the business knowledge. They need to know what data to visualize and why not to visualize one with another, and how to communicate those results back to the stakeholders. Because if we ask the stakeholders to read a coding, a program coding, or read a snapshot of all different data results, oftentimes they cannot interpret it very well. So we need this profession who connect the results delivered from data scientists, packaged well, visualize it, and then share insights with the stakeholders who can make a better decision out of it, right? So, so the definition for analytics based on the Denoise, which is a consulting company, essentially look at the application of different technique methods and to deliver insights to help decision-making process, to facilitate decision makers for planning, management, operation management, and learning, right? So that's essentially is the definition. But I think this is a specific diagram that we are built into the curriculum for the program. And so I'm going to further elaborate on different examples or different job positions that you might be able to apply after you finish the program study. All right. So let's see what I got a chat box. Okay. So Joe mentioned you're working as a data analyst in a revenue operations business in healthcare. That's very good. All right. So I think that's some portion of the job that we're going to talk about as well. So if we look at this, some of the data, some of the information I get from the market and markets and the markets.com, which look at the job markets for healthcare analytics. So that 4 major components that we're looking at how analytics can apply in the healthcare industry. So if we first look at the financial aspects, right? Remember, the general nonprofit hospital is running at a very thin operating margin. It's only 1.8%, which is very important for them to look at the financials closely. So some of the report from their Center for Disease Control as well as Institute of Medicine also look at the financial performance for a lot of hospitals. They are saying that over 500 hospitals, especially those smaller rural hospitals in the nation, are running the risk of potential closure because they could not manage the finance very well. So as from those numbers, you can see the importance for us to manage finance for healthcare. So dealing with the claim processing, revenue cycle management, and payment integrity and fraud, waste, and abuse. And there are tons of different ways for us to enhance financial performance. And one of the aspects, as I can give you an example, is looking at the waste reduction. So I work on a project with the local hospitals where I help them to analyze the inventory for a single unit in this hospital. They are actually managing over 2,000 of different SKUs in the supply chain term means different specific unique products. And that's just a small unit within a hospital. And one way for us to look at it is how to consolidate all those different products together so that they do not have to manage so many different individual products. And also they have a lot of waste in the process where because they have so large inventory, they have to manage. Oftentimes, they have some items sitting in their warehouse, not using for years. And so that's just one of the aspects to look at it. And then for operations administration, it is a lot of ways for us to looking at the supply chain, how to integrate supply chain with the clinical operations, database administration, okay, and also some of the strategic analysis, looking at how to align the business for healthcare with the strategical decisions that have been made. So one of the aspects we can looking at over here is for my research aspects, I also working with a lot of hospitals in the nation. One of the aspects you might experience in your region or in your country as well is access to care, right? And how to enhance access to care. Sometimes you get into those regions, there's tons of different care providers, but sometimes as you get into outside their urban areas, getting to rural areas, then essentially access to care is critical, right? And how we allocate those resources to make sure that the health inequity or healthcare access could be effectively addressed is one aspect that has been one of the top priorities for a lot of care providers now. Clinical, and we're looking at how to enhance the quality, enhance patient outcome, and also manage medical and healthcare services, reporting, compliance, and also how to address effectiveness. And this could coming from a clinical trial process where once you have a clinical trial data, how you analyze the effectiveness of the drug and how to compare different population to see and what situations the drug might be most effective. And lastly, population health. And this we're not just looking at a single database, we're looking at a lot of different data from public health agency, local government, and hospitals, care providers, to looking at, what drives certain disease in the local community and why there's a health inequity and why certain population are more susceptible, or are more likely to contract certain disease. So there are tons of different applications in this area as well. So some of the jobs that we're looking at for this industry, including, data analyst, data scientist, business intelligence analyst, management, analytics, healthcare economist, and consultant, administrators, health service managers, and data strategists. Okay, so, but I think one of the common characteristics that you can see is we focus on the data, and we also focus on the data and its application in the specific healthcare context. So it's very important for you to understand data elements also have a good knowledge base in this industry, understand the context very well.
David, right. I just wanted to add just very quickly, just as to everyone on the call, just as David was going on across the continuum for healthcare, what is beautifully designed by David with this in Rutgers with this program is where he actually shows you the healthcare industry. Within the program, you'll actually touch all of those components, right? The cost, the access, and the quality when he first showed you that component. But more importantly, I just want you to take a look at this job market of healthcare analytics slide. And I think what we can see here is even with COVID and the pandemic that we're in today, all of these components were impacted, right? COVID touched each and every one of these areas. So when we look at claims processing, we know that ICD codes needed to be changed, right? We know that there were significant legal ramifications around the financial components of how hospital systems and how healthcare in general was run in the US. In terms of the operational and admin components of it, supply chain, right? How much did we hear about PPE for the first time, right? And how important that was to all of our healthcare and our numbers, and basically it pushed all the way through the outcomes. So something as simple as a mask could really show you how that impacts health outcomes. The clinical, of course, in terms, of the hospital systems themselves. And then with population health, where consensus healthcare is sitting, really looking at healthcare analytics and seeing there are populations that are left out. There are minorities that have significant healthcare disparities, healthcare inequities. And it was really the first time that we got to see the data and say, wow, we didn't move just from volume to value. There were some folks that we lost even in the value and the volume components of it, right? Where we really didn't look at quality. We were really looking at, just the cost of it or the access to it, right? So we found even across the triple aim that David just actually went over with you, that COVID and the data really highlighted all of that in the healthcare industry for it. So, I can't say more about the program, just the timing of the program for it to precede something as significant as a global pandemic like this. But I just wanted to pull out that job market slide, just how significant it is and how the roles are actually needed and critical, moving forward.
Thank you, Tiffany. So I got some of the comments from the chat box. So Sunita is asking job market. So I'm going to share with the job informations in the following slides. So hold on over there. And we are working with our advisory board as both Tiffany and Joe, and both of them are actually working closely with us on their advisory board. We are, trying to establish more direct connection so that we can pay students through this network. But I'm going to share with you the information about a job placement shortly. Okay. All right, so I think this is the upward trends that everyone loves to see, right? And so one of the things that we can see that we want to work on an industry, that is going to growing over time. And this is exactly what's being projected. So even though, I work with a lot of our hospital systems, and one of the news that you might solve is a lot of our systems are following their employees because they could not have performed enough elective surgeries during the pandemic. However, what I can tell you is, even though some of the professions are getting furloughed in the healthcare, an analytic profession in healthcare will never get furloughed because they're always having problems to solve, even dealing with the lack of elective surgery, and then look at how to, redistribute these resources and how to highlight the different most critical emergency needs for patients. And all of those information with the data, and it provides tremendous opportunities for analytic professionals to help hospitals redistribute the resources, realign the resource distribution to address the business needs, during this dynamic time. All right, and so you saw this picture. And if you're not, and I guess you heard the news about all this pandemic going on, and we are hitting the second wave. And unfortunately, and the positive news we saw from the Pfizer and Moderna regarding the vaccine, and I think I'm positive that the vaccine would definitely help. But before the vaccine becomes readily available, I think we still have to address this issue, right? And so, but during pandemic, what we can do as a healthcare analytic professions, right? So I'm going to share with you some example. So some of the news you saw, right? And so first one, the shortage of supply, and not enough ICU beds, not enough ventilator. And then in the second wave, I think we're going to get into the same issues again. And also with the testing, and then multiple different testing sites opening up now, but still you see a very long waiting line in front of them, right? And so what can we do to better managing the distribution? Right now is for the testing kit, and the next one is going to be for the vaccine. And so last one, of course, and we all saw the good news with Moderna, but if you're looking at what happens prior or during the pandemic, it was really, how to say, uh, a very speed up processes, because usually the vaccine needs to go through years of clinical trials. And eventually the FDA might getting the approval. But now, under such a short time frame, and all those pharmaceutical companies are trying to speed up the process, right? So there are a lot of issues that need to deal with during that process as well. So here's going to some of illustration, right? And during the coronavirus pandemic, and if we're looking at just in the care provider setting, and there's a recent article called "The New Hospital During the Pandemic" by Wall Street Journal. They look at specifically, what hospitals are trying to being creative, innovative, and the process in order to address the issues. The first one is the triage process, and how to identify, have a early detection to isolate COVID versus non-COVID patients, right? And so that there's less hospital acquired infection during patient stay in the hospital. And that is one of the big issues that each hospital is dealing with right now. Well, we call it the descriptive statistics or descriptive analytics. Essentially, this how we can, come up with certain specific profile so that we can identify patients prior admission to a hospital that he or she is potentially subject to the COVID and needs to be in a separate isolate units compared with the regular patients coming over for elective surgery. Second one is the operations and planning. And so how we can ensure we have enough people stand by, physician, staff members, and nurses, how we have enough designated beds for patients, how we ensure we have enough supplies, and how we deal with the cancellation of elective surgery so that we can still operate the business during pandemic, right? How to ensure we have enough ventilators. So this is dealing with the predictive analytics, but specifically in the healthcare context. And the next one, we're looking at speed trials of vaccine and production of test kit. And so this is dealing with the prescriptive analytics. And last one, dealing with the population health, where essentially how we can identify how this virus is being transmitted from person to person, how we're going to determine we're going to have a massive lockdown, we're going to have a specific regional lockdown, right? And identify population at risk, prevent during the quarantine, travel bans, and business closure, right? And so this actually goes a little bit more high level into machine learning aspects of the healthcare analytics. So if you're looking at this 4 different components by itself, right? And you can see from the news report and from all the different stories we heard from the TV that this is happening. And this also really calls for healthcare analytic professions to join the workforce to help better improve the process we are dealing with right now.
Yeah, David, I just wanted to add just,
Yep.
Just some real world experience in these components. Some of the things that we're seeing coming into consensus. I know someone in the chat asked about pharmaceutical companies because we were talking about the vaccine itself.
Yep.
But even if consensus gets a question that is around even distribution of the vaccine, right? And we think of it in a supply chain landscape, some of the questions that they're really asking is for us to give them data so that they can be very objective, even in a distribution from a moral standpoint of who, when we look at population health, how do we distribute it? How do we do a tier 1 distribution? How do we do a tier 2 distribution? Only data can really answer those questions, right? From a base level of how do we even get the vaccine to the proper people at the proper time, right? Then you can back up. We have had calls come all the way in post-COVID that really is saying, let's look at the data even beyond COVID. We need 24 months worth of what we think may happen, Tiffany, and we need tools to tell us to be prepared for those types of things. So when we move through these descriptive, predictive, and prescriptive, just basically this continuum that David, has given us, I just wanted to give just some real world examples of how, when we get questions from the industry, data is what is ultimately driving, how we pivot if we're going in the right direction, and the mistakes that we make, as a result of not having the data and where we are actually blind to all of this.
Thank you, Tiffany. And so I think in the chat box, Annie is asking whether pharma companies consider healthcare system in the context of program. So yes, we do, even though that's not the main focus, but we do have part of the curriculum that relevant to pharmaceutical related industry. And so even for Radcliffe Business School, and we have one of the best pharma program in the business school as well. And so if you're interested in pharma related specific, and when we get into the curriculum section in the next few slides, and we can have a little bit more discussion for that. Okay, but definitely both Tiffany and Joe is coming from J&J from a pharmaceutical standpoint of view into dealing with the supply chain. And that so many different ways for us to connect with the industry from the program. Okay.
Yeah, and I would just add, David, that part of our experiential learning focus is working with the Johnson and Johnsons, the Catalents, Biogens, people like that, to give you that experience in the business. So it's you'll develop a good network in that end of the business as well.
Yeah, so thank you, Joe. So I think one of the aspects we're looking at from here is healthcare analytics is not bonding to specific discipline. For instance, I mentioned hospital quite a lot because the main players in the industry, but I'm not saying we're excluding pharma or healthcare service, such as those a little bit more, for instance, manufacturing for the medical equipments and those testing facility. We are not excluding them. Rather, we want to have a little bit more open-ended kind of a curriculum, so that, especially as Joe mentioned, when it becomes for you to get into experiential learning, and we're trying to bring in different companies or organizations into a program so that you can pick up the one that fits your interest the best. So using that as opportunities to practice with what you learned. Okay, so we're going to have a little bit more further discussion for that in the next couple of slides. So why this program at the Radcliffe Business School, right? And so yeah, before we get into that one, so if you new Radcliffe or Radcliffe Business School, so we are the #1 public business school in the Northeast, in the East Coast. And there are a couple of different rankings, and the programs that you are interested in is situated in the supply chain management department, because we see that the analytics has a big application into matching the demand and supply, right? Not necessarily the traditional supply setting, but if you're looking at the patient, if you're looking at the pharmaceutical companies, and all of those are part of a large supply chain. Our supply chain program is ranked as a top 3 in the nation. And and also we are situated in one of the best state, which is New Jersey, very close to New York and Pennsylvania and other different 12 states. So job-wise, I think if you're interested, if you're young and interested into some of the very dense population such as New York, and is only one river away. So so objectives for our program is really for professionals who are interested in gaining the competitive advantages, so that they can apply different analytic tools to create a little bit more what we call the data-driven solutions to address some of the very complex issues, problems in the system. All right, so this is a 36 credit. It is a customized curriculum. So as we get into a curriculum, you can see what I mean for that. And we have students from different education backgrounds, which I'm going to elaborate as well. And for students who have prior graduate degrees, because we do have PharmD and or physician and the students in the program, if you have attended prior graduate programs, finish your graduate study, and we can offer the opportunities to waive or transfer up to 6 credits. If you have more than 5 years relevant work experience, we can also consider the waiver of up to 6 credits for those relevant work experience, okay? And the curriculum is not only developed by ourselves, we collaborate with multiple different departments, even different colleges, to create a cutting edge cross-functional curriculum, which provide you with the best course options for healthcare, business, analytics. Okay, and let me see. So here are our the team that I want to introduce. So so you saw myself and Joe over here. Tiffany is part of our advisory board, and Katrina is our coordinator for our program. Nick Resnick is he was a principal at Deloitte. He is teaching some of the courses for us, including the client project, which is an experiential learning course, and the evaluation course, where I think Tiffany probably will going to share a lot of for that, which is a very valuable course into a program. And Michael Crocker, and he was a VP for Bayer, which is one of the both Joe and Mike is coming from the pharmaceutical industry. So we do have a very strong tie to the pharmaceutical industry in the program as well. All right, so curriculum, right? And so we mentioned this cutting edge, this multi-discipline and multi-department curriculum. So when I finalized the curriculum, I got a lot of different inputs from the stakeholders, from industry, also from the professors in our program or outside our program. What we are trying to do right now is to provide the different ways for customization, because as I mentioned, in the next slides, I'm also going to elaborate. We have quite a diversified student population. Some students are coming from healthcare industry as a physician, as practitioner. Some of the students coming from pharma industry. Some of the students actually are coming from supply chain and analytics industry. And some of the students has not have much working experience, but they are highly motivated. They're also very good at analytics work. So that's why we have to consider all those different variations to provide ways to customize so students will get the best out of the program, and which oftentimes you don't see this for other programs. All right, so for healthcare core, right? And so over here, I listed all the 6 different courses. And the way for customization is students can select 3 courses out of the 6 to satisfy the 9 credits requirements for this portion. And then for the next business core, students can select 2 out of 4 to satisfy those core requirements. And the next one for the analytics and intelligence core, and we also have quite a few options where students can select 4 courses out of this pool, so that can be utilized to satisfy. So it depends on where you come from, what you're interested in. You can look at it be more close to application of analytics, or how to do programming, or how to apply this analytic work into the healthcare context. Last one is the internship and electives. So the industry client project or internship is a required component for this course, for this program. So students can either do internship and using that internship to satisfy requirements, or we suggest students to join the industry client project to have experiential learning with a specific sponsor in the healthcare industry. All right, and then there are this one counts for 3 credits, and then other 6 credits or 2 courses coming from all the different options, as you can see below. So the way for us to emphasize this is a customized curriculum again. So if you really are hands-on, really want to get into data scientist aspects, looking at the programming, data structure, databases, and you can use it as a way to customize. If you are coming from non-healthcare backgrounds, want to really know the context a little bit better, and you can also, based on assumption you satisfy basic requirements, you can also use an inactive to customize, the type of healthcare courses you want to select. So we pull up the course from our program, with the supply chain department, management department, accounting department, as well as the School of Public Health and School of Public Policy. And so you will have multiple different options to get different exposures to different learning experience as well. Okay, so so a couple different options, and for students who pursuing full-time option, this will consider the fast track. where students can get it finished in 3 semesters, or if they really work very hard, it's possible to finish in 2 semesters. However, what we suggest for students is try to take the summer semester to do either industry client or internship, because that will add a lot of value to your resume. If you are new to this industry, to this major, or you are trying to consider expand exposure to analytics, and using the summer is going to be very valuable. Okay, but however, if you really want to get it done in 2 semesters, there is a way to get it done. Okay, and we can work together on that. So we have a rolling enrollment basis. So we're accepting spring and fall enrollment. And in this coming summer, we also open up the summer enrollment as well. Okay, but those summer enrollment mainly applies to students who really need to use the summer to start up with the program. So most likely for a lot of students who are working professionals want to join a program, we suggest a 2-year part-time program where students take up to 3 or probably even 2 courses. Most of them finish within 2 years or a little bit longer than 2 years. The maximum time that students can spend to finish the program is 5.5 years. Okay, and so, but usually we don't have students stay that long. Okay, so student profile. This is the most recent semester, the fall 2020 student cohort. We have 35 coming from healthcare, and you can think about the physician as practitioners or with MD degrees. And we have 17% with analytic experience, not necessarily in the healthcare, but they are very interested in getting into healthcare. 7% as a farmer with specifically pharmaceutical industry experience, and 39% are marked as other. What that means is that do not necessarily have exposure to healthcare before. They probably had internship or part-time job before, or they are students directly coming from undergraduate program, but they're very motivated, very interested in this great career, and so they would like to pursue our program starting. Okay. All right. And so next one, I'm going to share with you some student profile, right? Years of working experience. As I mentioned, we have some of the students who have been working probably even longer than 10 years in the industry, and average GPA 3.2. Age range, we have a very dynamic student population. The background from students, business, science, healthcare, I should put engineering back over here as well, and some IT kind of background as well. Placement, so it depends on, I don't think we have a generic profile for students. As you can see, we have quite a dynamic student population. And I think that is one of the benefits for you to join this program, where you get different exposure. You might, well, so far, we are not yet, have this face-to-face courses open up for all the courses. But moving in the spring semester, we're going to have some of the course in a hybrid formats where half of the time you will do online, half of the time we do face-to-face. But you might be talking with a physician next to you or a nurse practitioner next to you to see exactly what they have been doing up to date. You might be talking with some people who has been working in the healthcare IT. You also might be working with some people who has been working quite a long time in the analytic field to get a different exposure. So the discussion we have in classroom is fantastic. It's very dynamic, and that you don't get that exposure very much from other programs. So students placement, as I mentioned, depends on the backgrounds you come from, how much you learn, as well as internships that they might be getting during the summer or other times. And we have students placed with pharma companies or hospital, and specifically. And we also have quite a lot of students went over with the consulting industry. For instance, Tiffany opened up her own consulting industry, and students placed with some of the ECG and assignments, healthcare. And the COPE is one of the very advanced consulting companies based in New York and California. And we also have students who with a clinical background went over to assuming some of the faculty positions with the medical schools, or acting as the faculty practice manager or medical service manager at Columbia University. All right, and so I do not have a whole list, and if you are interested, I can provide you with those information. But generally speaking, I think that a couple of different main outcomes for students. One is going to healthcare specifically in hospital or pharmaceutical industry. One is going to more towards the medical practice, is consulting with the medical practice or healthcare practice, or goes into the actual university, for instance, Columbia or the Jefferson, Philadelphia University. All right, and so we also have students, doing the startup such as Tiffany, and we also have students, who going through a medical students training processes, and so that's why it's difficult for me to profile specific typical students, because really depends on what you bring into a program, what do you get out of the program, and the type of internship and the client project experience you might have. All of those three together, right, and it will determine exactly what kind of job market you might have a good fit for.
And then, David, just to talk a
Yeah.
little bit about the student profile and just the design of the program, I think it's just so unique. If you guys look at the student profile and you look at the coursework itself, right, realizing that you don't have to be directly from the healthcare industry, right? The Rutgers program will give you those components, and what you don't have in business, we'll be able to give you courses in that as well before you actually start to specialize in the analytics portion of it. But what really sits out to me in looking at this is the collaboration that David talked about earlier that's really needed, right, to be really effective. And, I just want to point out just the diversity of the coursework, right, how the program is allowing you not to just be siloed to be an MD to get into this program, right? And then the student profile is just so diverse to just really get at that collective diversity, to really get that diverse thought. And, as a result of that, I was able to really kind of pivot Consensus Healthcare and be really innovative, not just from the coursework, but also from the student population that's actually sitting in the classroom with me. It's very robust. He'll get into some of the other components around the business valuation course, but you really start to be able to sit in ideation, is what they call it, and really bring ideas to the table with the knowledge that you're learning, with the data. So I just wanted to point that out as being, extremely the significant differentiator for me.
Thank you, Tiffany. So I think one thing I also want to have a follow-up comment for that one. So I'm going to speed up for the next couple of slides. Is the issue we're facing in the healthcare industry cannot be solved by the existing model we are using, because we already see the frustration. We also already see all the different challenge issues we are dealing with. So we do need to have creative, innovative approach. And oftentimes those approach will not necessarily coming from healthcare people. Sometimes those solutions will coming from other industries, because just looking at the healthcare IT or EMR, electronic medical records, and if you are familiar with that one, when you say doctor, that not necessarily talk with you eye to eye, but oftentimes they turn to a computer typing this information. So it takes a decade for the hospital system to adopt EMR, which for other industry, this would never happen. If you don't do it, you're going to get out of the business, right? So what I'm saying is there's a lot of unique challenges, issues dealing with the healthcare, where I would say that the way for us to develop this curriculum, as Tiffany mentioned, we do need to have some out-of-box thinking. We do need to bring in different minds together and to collaborate together in order to find a solution. So that's why I think we do not specific saying what you have to have healthcare background in order to join the program. No, that's not the expectation, but we do expect you to have a very strong interest, see the potential application, see yourself in this industry down the road. So that is very critical. All right, so how to start, right? And so for those of you join today's session, I think the admission office will be able to waive the application fee for you, which is big bonus, I would say, right? And the quality time well spent. And then we require 2 letters of recommendation, and ideally one is from your academic advisor who can evaluate academic performance. Another one is from your, if you're working with from your employer or your boss, who can evaluate your, your contribution to the job as well. So, however, if you are either just out of school as a fresh graduates, or you have been in the industry for a long time, and what just, whatever work the best for you, and that for us to better evaluate your qualification and as well your interest, and try to get in those letters into your application. And essay part is really, we spend around an hour up to this point to kind of talk about the importance of this industry, as well as how this major might contribute to this industry. I think we want to see how you connect yourself to this industry, right? And how you see yourself grow in this industry, what you want to get out of it. Transcript is, of course, very standardized, GRE-GMAT, and we provide the options for waiver, and this will be evaluated based on individual cases. And if you're interested in this option, please send me an email with your resume and the transcripts. But we do prefer, if you can take those tests, this will be a good way for us to evaluate your ability to finish graduate studies. And for international students, TOEFL definitely, or IELTS is definitely something we will require. All right, and last one is your resume. So do make sure that if you send in your application, update your resume with your most recent, working experience or your most recent academic performance. So if you are currently undergraduate with RBS, and we have this, what we call the accelerated track. So if you meet the minimal bar, which is a 3.0 GPA and major GPA of 3.4, and also finish 75 credit hours, you can start apply to our graduate program, during the second half of the junior year. So if you're getting admitted into a program, then essentially during the senior year, you can select up to 6 credits, from our graduate program, using that to fulfill both your undergraduate requirement as well as your graduate program requirement as well. All right, so if you are interested in that one, you do not have to apply. You do not have to pay the application fee. You do not need to submit any test scores because we already have your GPA in the system, and we don't need you to have any reference letter. You just, send a simple application and with your resume and your statement, and we will be able to process your application. All right. Okay. So, and if you are not yet ready to start as the program students or the degree students, we do have the option for a graduate certificate. However, I want to mention that we have the same requirements for certificate students as for degree program students, and we have the same expectation for both. And because they're going to sit all together, and we will not differentiate those two. And I would strongly encourage students who are interested in this program to the degree program to think what might works best for you. And the certificate is a way for you to test water to see how the course is being conducted. However, we provide a certificate with the expectation that once students finish a certificate, they should be interested in further pursuing the program, the degree program. Okay, and so so basically, the benefits for the certificate, of course, you do not have any obligation to join the program as degree students. And if you decide to join, and if you are admitted into our degree program, so all the 12 credits you accumulated through the certificate will be applied. Okay, so that is, if you want using this as a buffer, as a way to test the program, that's fine. But just want to mention again, we have the same expectation, same requirements to certificate students as the degree students. All right, so some of the testimony from students, and The three different students went off to different type of career paths, and the first one went over Columbia University as a faculty practice manager, right? And his quote is, "The future of healthcare is data-driven," as you saw from my presentation. And the program empowers you both analytics and business management. And the second students went over as a consultant with a Medidata solution, which is a very large consulting company, right? And so he has a very interesting background. He has been working with a healthcare government agency for quite some years. And he decides to get out of that position, want to explore different career opportunities, specifically in consulting industry, want to apply his analytic skill set. And I was very glad that he was able to, get into this consulting industry. But his quote is really, "The program opened doors to rewarding new career choices that he did not have before," right? And the last one is the project manager at United Health. I do see that this is dealing with the insurance, which is a healthcare service company, not necessarily directly care provider, but he gained a lot of understanding for the industry from those courses such as operations analysis and healthcare finance. Now he feels comfortable to improve the efficiency and quality of healthcare. All right. So here goes the industry testimony, and Michael Berger is the Chief Data and Analytic Officer with the Mount Sinai Health System. And his kind of quote to our program is that there's a huge gap in the industry right now. We need the people who has the technical skill set, which essentially is the analytic skill set. At the same time, have good understanding for the health industry, and preferably have some of working experience as well. And so basically what we are trying to do from the program is we train you with the technical skill sets, and we also provide actual data sets for you to work on. And through the experiential learning and potential internships, that you could accumulate the experience working with those data as well, right? And so I think those three bullet points, as you saw from his quote, is going to be fully addressed through our program. So he envisioned our program become a feeder program as part of industry with a demand for analytic skill set. And again, so he has seen a lot of disruptive transformation to healthcare so far. If you're looking at the trend for the industry, we are really going to digitize a lot of data, a lot of information in the healthcare industry, from the wearables you're using, Apple Watch, right? You're using, to the actual electronic patient records, over to public health information, and then to your claims information. There are tons of different data that we can consolidate so that we can really transform how this business is operating, right? Okay, and so with that being said, I think I'm trying to meet my 1 hour timeline. I think I'm 101. So, okay, I'm going to stop here, and we're going to open the floor for questions or any issues you might have. Okay,
well,
so
I had asked this in the chat a little bit ago, but I'd like to just kind of reiterate. So I have a background in more of the mathematics, statistics, and analytics realm. Would you recommend a specialization in those analytics courses in order to strengthen kind of those skills, or would you recommend a redirection towards the healthcare courses in order to get that more well-rounded kind of viewpoint?
That's a good question. I probably need to have a better evaluation based on your resume and your transcripts that you have taken. But I think if you feel that you're very comfortable with mathematical and analytic components, I think what you need to equip yourself with is really how to apply those things in the healthcare context, which is geared towards your second option, which is more exposure to healthcare. However, I think it's important to know that healthcare industry is quite different from other industries. So what industry you are working on right now?
Right now, I'm currently pursuing my undergraduate degree in mathematics with a minor in statistics. So I don't actually have any specific industry experience.
I gotcha. So I think through their program, what we are trying to look at, I think for especially for undergraduate like you get exposure to a lot of theory, right? A lot of formulas, a lot of probably some application as well. But
Mhm.
through the graduate program, what we are looking at is really how to apply those theory, those concepts into application so that you can actually make it work. So even though you're going to, I don't necessarily think that the analytic course that you're getting from the program is a waste, because most of the analytic course that you're going to take from program will cater towards application. In business school, what we are looking at is we want to be business focused so that you are able to address actual problems, issues, and with your analytic skill set. And so some of analytic course will cater to, for instance, program Python or R programming will help you to review. So if you already have experience in those, I think you can actually waive those requirements, but you can supplement those with other coursework, which help you to better connect your mathematic and analytic skill sets to the actual industry. Okay, so but I think the way the curriculum is set up to be customized is something that that we need to talk in order to understand where, what worked best for you and how you can better maximize the learning experience you have in this program to help you to get a good job, right? So, but definitely, I think that's a good question. I'm not sure what I answer your question, but I would say that I would suggest you to look more into the healthcare
Right.
context, but when you come into the application of what you learned in this industry, you still need some of the funnel, which essentially some of the coursework through the program as well, because otherwise, uh, so one of the things I learned from the industry is a lot of hospital or healthcare industry people saying, well, they hire data scientists to work, right?
Mhm.
But it takes forever for them to really work together, because data scientists oftentimes they don't really understand why they're doing the work they're doing for the healthcare industry. They don't understand the
Exactly.
large picture. They know how the data look like, but they just could not make the data results to tell a story, right? They cannot use those results to point to the right direction for those executives in terms of what's the next step. So that's why we feel that if you already have some of data scientist kind of exposure or mathematical exposure before,
Mhm.
it will be great for you to, um, looking at the actual, I'm not sure whether you join us as I present the three diagram, three bubbles I presented,
Yes. Yep.
that yeah, really be able to, you can step your one foot in the data scientist area, another foot, another foot in the analytic field, so that
Mhm.
you can make that transition very easily. So that will be a very unique careers, I think, positions for you down the road as well.
Excellent. Thank you very much. That answers my question very thoroughly. Thank
Okay,
you.
you're welcome.
Hello.
Yep.
Okay, so I had asked you a question. I'm from India. I've done a undergraduate course in business for 3 years. And since this is a master's course, do I need to complete any extra credits or am I eligible for this program?
So you finished a 3-year bachelor degree program, right?
Yeah, right.
Okay, and so I think I'm not very familiar with the program set up in India, but if it's equivalent to bachelor degree in United States, and I believe there are some of the certification agency that you can work with. If you need that information, I can pass them to you. So if it's certified that
Okay.
your degree is equivalent to bachelor degree in United States, and then
Okay.
definitely you are qualified to apply.
So who do I contact for like for the application process if to know if I'm actually eligible?
Yeah. So can let me type in my information. So you can see my emails in
Yeah,
this
yeah.
chat
I
box as
have
well
your
as on the
email.
slides. Send me email. I will connect you with the admission office so that might give you better instruction in terms of, what process to certify your degree, to confirm that there is equivalent to bachelor degree United States. But
Okay.
I did think that I saw some of this, document before. So there's a way for you to do that.
Okay, okay. Thank you so much.
You're welcome. So I think I have another comment from Saja, and from India with 4-year engineering degree, 6.5 out of 10 with 2 years experience in healthcare industry. I'm eligible. I don't think there's any question related to whether you're eligible or not, because I think definitely with your engineering backgrounds and your exposure to healthcare industry, definitely we welcome you to submit your application to our program. And as I mentioned, please use their personal essay to articulate your interest in this program and how you feel this program might help you to grow, and what's your career path that you would like to pursue after you graduate from this program. We just want to see a right fit, in this program, as well as how this program might help you. Okay, so please, if you are interested in submitting application, of course, I do encourage you to do, because that the industry, as you saw from the presentation, is in need a lot of healthcare analytic professionals in this industry.
All right. Thanks, sir.
Okay. And so Sunita asking, do we have a lot of international students accepting this program? Yes, we do. And we right now, I would say we have 35 to 40% of students coming from international. And so we do accept international students. As I mentioned, one of the common question from international students is whether, the knowledge they learn in this program about United States health system applies to international countries. And I think, as I mentioned, we are facing the same challenge, issues, problems. And I think United States might become the best country to start healthcare, because we have so many issues, problems in the system itself. If you can find solution, to problems we're facing, you definitely can bring the solution back to the other country that you come from. There's no problem. I don't have any doubt with that, because we all face the same issue, dealing with the reduce cost, reduce waste, improve efficiency, enhance patient outcome, better address health equity, and so that those issues, those problems are essentially the same. One of the good things for you to start program in our program, especially in the United States, is we have access to the data, which make the data analytic work very interesting. Because if you come from some of the countries who has not yet established such a good data collection or data, publication records, then it becomes challenge. But with the data we have on hand, it really enables us to answer a lot of different questions. So how many credits for degree? This is the MS degree. This is a Master of Science in degree. We are a STEM. I'm sorry, I forgot to mention. We are a STEM degree, which means especially for international students, you will have up to 3 years of OPT through our program. For non-STEM, I think you only have less than 1 year. So what that means is you will have more time to getting working experience in the United States. So if either you determine to go back to home country, want to try to stay, getting H-1B visa sponsorship, that should provide you with more than sufficient time. Okay, so if you are looking for different degrees to apply, and as I mentioned, I think our program is very unique in the sense it provides you with a customized curriculum. We have very diversified student population. We have very designated faculty member working with the program. And we also welcome international students. And we are STEM accredited. And we are situated in one of the top institutions in the nation. And we are close to New York. And we're in New Jersey. So I think that's all the different, very positive aspects for this program, which I hope encourage you guys to apply. All right. And for international students, I think the International Student Office suggested, in order to get your visa, in order to start the program, I think you already passed the application deadline for the spring 2021 semester. For international students, you should look at the fall 2021, because that will give you sufficient time for getting your application, we review, and if you admit it, getting to your documentation ready for apply for visa, right? And getting new I-20. So especially for international. So scholarship opportunities, so far we do not offer scholarship directly from the program, but we do have assistantship available in the program as well at the department level. So that is considered as a very competitive assistantship. Depends on your qualification, and oftentimes is after you get enrolled in the program, and depends on your academic performance, and you might be able to, receive some of the assistantship positions. By when? So for international students, I would suggest as soon as possible. I think the deadline we put out is going to be before April 1st. All right, and so that's something that I really suggest you to think or start early rather than wait until last minute. And for this year, we do not know what's the visa situation. And I'm positive it's getting better, but I cannot predict exactly what's going to happen. So what we're doing right now for the spring 2021 is we're going to have some of the course in hybrid format, so that that will help to address some of the visa requirements for some of the countries. And in the fall 2021 semester, I do not know how situation will evolve. I hope it's getting better so that we can resume most in-person classes, but I cannot predict at this moment. All right.
Hi, David. First off, my apologies for joining the meeting late, but I just wanted to ask a quick question about short and long-term opportunities within this degree, and like how you feel it could apply to like both within the healthcare space with like short-term, just breaking into working within like healthcare analytics, like at the hospital level. So like just directly for hospitals, and then long-term, like building the foundations for success within, potential like starting your own, business, whether it be something more like in just a specific type of healthcare or general.
Yeah, well, so I think short term, not necessary, but I think you're correct that definitely we do have a focus on hospital, but also we also have some other focus on the pharma and the supply chain and other different disciplines in the healthcare industry. So I think in the short term, and if you graduate from this program, I think directly you should be able to get in some analytics positions, and with not much issue. But again, in terms of where you get those positions and what type of setting, that really depends on one thing is your qualification, right? And we do have some students with a lot of pharma industry background or some of the biomedical kind of a training experience. And for them, the natural transition was more getting into a little bit more close to pharma. But for others, I mean, that's just one example. So for the long term, I think as you start to working in the analytic field, you're going to realize that there's a lot of way for you to grow. And so basically one way for you to looking at this one is to we're looking at from the supply standpoint of view, right? Healthcare provide care to patients. And then healthcare also need to get supplies from the pharmaceutical companies and those medical equipment suppliers or PPE suppliers. And so this is a large chain we're looking at. So some of the people I saw in the industry in terms of the career path, and they're going from healthcare analytics and then looking at specific area, and later on they expand the scope, the more looking at the corporation, the organization level, or the healthcare provider level. And then they're going up in terms of the governance agency and or healthcare agencies to looking at a little bit more larger scale. Some of them will go down the route, specialize in this, and as you mentioned, can develop their own companies really specialize in providing this type of analytics work to care providers or other industry partners. So yes, I think could be one way for you to think about your career path. And other career path, if you really do good job in analytics and in organization, you can become, the chief data analytic officers, just like Michael Berger with Mount Sinai. Or you can also really be able to get into the CIO positions, chief information officer, if you are really good at the data scientist aspects, and for those type of different positions. So yeah, I hope I have a single answer for your question, but I think there are so many different opportunities for you to explore. So I don't think you're not supposed to, kind of limit yourself to just one, but look at what look at what the opportunities you might have based on your profile, your qualification, as well as your interest.
Exactly.
And,
absolutely.
Yeah. And so we also in classroom, we invite industry executives, industry leaders to classroom to build a network to connect with you guys, with students in the program. So those are also good questions you might ask them as well, to get, and I think Professor Joe Agresta is also developing their mentorship programs, right? And so that we're going to bring in industry executives to serve as a mentor and for students in this program. So those are the questions, very good question you can ask them as well,
Yeah, no, and I guess coming from my, standpoint, like I just didn't even realize how much opportunity even just existed. I guess which is like very exciting, obviously. And then I guess that's the second follow-up question is, my background experience kind of lies more like within kind of like the third-party logistics supply chain space. But, with a big emphasis within like, data analytics, like as a, solutions consultant within the company now. Do you think, me looking like to this role kind of to expand on like my own interests, with this being also like a STEM degree, like, how does that potentially like, is there a good translation for people coming from like more like an implementation side in a different space into the healthcare side?
Well, that's a good question. I don't think, so we are in supply chain program, right? And so especially for supply chain undergraduate students coming from supply chain, I think we have a huge need for supply chain optimization for healthcare industry, as you saw from TPE, right?
Yeah.
So I think, but in order to put your supply chain knowledge into practice, I think you still, again, just like another student just asked a question about his background in mathematics, right? And you need to understand the industry very well. And you also need to understand, because some of the specific general supply chain application do not necessarily apply in healthcare industry.
Absolutely.
So you need to understand the industry very well. You also need to see what is the most important issue that you might help contribute, and connect your supply chain knowledge with analytic skill sets as well as your understanding for the healthcare industry. I think that will place you in a very unique position. I think, as I mentioned, this is a very dynamic program. I don't think everyone follows the same path.
Mm-hmm.
Really depends on how you envision yourself, what you think you are most interested in. And I think we have a lot to offer in the program. Oftentimes I end up with talk with individual students on individual basis to see what we can better offer. But I think for your situation, combine supply chain, analytics, and healthcare, you're going to get too many different job offers, I guess. So from that standpoint of view.
That's exciting. Well,
yeah.
Thank you for that information. I really appreciate it.
You're welcome. So I have a question, Dylan asking assistantship opportunities for doctorate students. Yes, those assistantship, I would say, is more like grading assistants or almost teaching assistants. Those are not published on our course page. So basically what happens is some of the centers, we have a lot of centers in the school. Some of the faculty members, when they're teaching courses, we do not necessarily all use doctorate students because we don't have enough doctorate students to serve as assistantships. So we do have certain number of assistantship at the department or the center level, which we do not publish. Okay, those are the positions once you join the program that you're going to explore. All right. So for Yongyu is a full-time program. Yes, we offer this program on both a full-time and part-time basis. However, if you are international student, I think under the visa requirements, you will have to pursue full-time status. But if you don't have that requirements, feel free to do part-time. So full-time option, we suggest students to do, well, they have to do 12 credits or 3 credits courses each semester, which according to our calculation, you can graduate in 3 semesters. And for part-time students, we suggest students to graduate in 2 or up to 3 years. But if you choose a part-time option, you can finish a program up to 5.5 years. Okay, so that's the essential time frame we're looking at. Okay, any other questions? We still have a few minutes left.
Hey, just one more question, David. Just how much emphasis do you guys within the program, and I don't know if you covered this before I joined, but do you guys put on economics and how it relates to the healthcare industry, like just general principles or, specifics of like different economic theories and whatnot?
Yeah. So the coursework, actually, you can choose healthcare economics or healthcare finance to address that issue. So both courses will cover components dealing with how economics apply. Yeah, that is one of the very important aspects for sure. Saja, if you want to get a recording, I think I should be able to, if you sign up this webinar open house with your email, I should be able to get that one after we finish this session today. So what I'm going to try to do is I'm going to post the link, the record link on YouTube. And so, and then once I get that done, I will send you guys a follow-up with the link to that recording. So you should be able to review that if you want. Okay, and I did have the previous recording on link on the YouTube, and but I think we made some adjustment to materials, and we also have Joe and Tiffany join us today, and I think we have a very good discussion today. But as I mentioned, I think I do see this is a very promising career path for those of you who are interested in healthcare, understand, the importance of healthcare to our society. And I did not start as an academic in healthcare. I started as an engineer by training, and I just through my work, through my collaboration, I just feel that healthcare industry is an industry that need a lot of work. What that means is it's good because it's going to create a lot of job opportunities, and which is also a never dying industry, right? You see, we have so many different age population, and we have all these new diseases, and it's a never ending business. So if you choose a career path in healthcare, it's a lot of industry will eventually disappear. As you know, that with the digitalization, with the AI, with BI, a lot of the industry will eventually disappear. But for healthcare, it will stay, right? It will stay forever, because as long as we, as a human being, we always run into diseases, getting sick, need help, need healthcare. So for those of you who are not in healthcare or interested in healthcare, I really encourage you to explore this, because if you worry about what your job market will look like in 10 years, in 15 years, right? When you're getting older, because when you're getting older, it's difficult to make transition because your skill set is pretty much settled. But if you are in healthcare, I think there's a lot of way for you to move around to explore new career opportunities. Okay. So I'm going to stop here for a few more minutes to see whether any questions might have from you guys. All right. So if no more questions, and you have my email, send me an email if you have any requests. If you want to connect with either Tiffany or Joe, let me know. I will help make the connection. I think I should have addressed all the questions. I was looking at the chat box as well. We should have already addressed all the questions in the chat box. So, all right. So I think that's pretty much all for today. And so let me see, make sure. All right. Okay. Thank you guys. So especially for international students, and unfortunately, you could not start with the spring 2021 cohort, and you will have to look at the fall 2021. So if that's the case, I encourage you guys to explore information if you need more, or if you're ready to start right now, don't wait. And if you have not taken GRE GMAT test, I encourage you to do so. It will be a good test of your, analytic skill set for sure. And I look forward, to talk with you guys individual basis down the road as well. Okay. All right. Thank you guys. I'm going to close up the meeting now. Thank you, Joe. Thank you, Tiffany. And thank you everyone for joining today's session.
Thank you very much.
Great. All the best to everybody. Thank you.
All right. Okay. Thank you. All right. Okay. Bye for now. And everyone has a good holiday season.
Yes, you too, David, as well, and Joe, and everyone. Thank you.
All right.
Bye-bye.
Okay. Bye.